All right, wrist cars. So the wrist is fairly simple and straightforward. We basically have some little bones in the wrist, and we're moving those bones on the forearm bones. So when we're doing wrist cars, what we're trying to do is we're trying to now, that rotation piece that we worked on in the elbow cars, we're actually going to try to dissociate that from actual wrist movements. So when I'm doing my wrist car, I'm trying to bend my wrist as far as I can back. Then I'm taking my pinky and I'm trying to bring it as far as I can over without rotating my palm. So I'm bending this way as far as I can. Then I'm coming in. Then I'm coming up. Then I'm maintaining that position and I'm coming across. And here, this is where we tend to want to rotate from the forearm, excuse me. So we're trying to, again, how much motion can I get from the wrist itself? Then as soon as I've come this way, as much as I can towards the thumb, I'm going to maintain that position and then pull my wrist back again into this position. So I'm trying to create as big of a circle as I can with the tip of my middle finger, pretending like that is a Sharpie marker. Something that's helpful sometimes is balancing something on your forearm. Make sure that's something that wouldn't be devastating if it fell on the ground, although that does give you some good motivation to not move your forearm. But trying to make sure that you can move your wrist, again, independently of the forearm. This is a really helpful technique, especially with people who are typing a lot at the computer. So you can do wrist cars with the fingers straight and then also with the fingers in a loose fist position to really work on more range of motion. You tend to have more range of motion in your wrist when your fingers are a little bit bent compared to when your fingers are totally straight. So again, do a couple circles, cars clockwise, counterclockwise, and then move on. Just a quick pearl about wrist cars. So a typical thing that happens with wrist cars is we actually feel that we have way more motion going towards the pinky side in the wrist than we do going towards the thumb side of the wrist. And when we don't understand why, some people will really jam in the thumb direction and then get closing angle pain on the thumb and then wonder why, or they get some concern. So it's actually normal to have way more motion coming this way towards the pinky than towards the thumb side. And anatomically, it's because one of the forearm bones creates this little hook mechanism right here. So moving towards the thumb side is actually, there's a structural bony block right here. So we naturally have, again, more motion going towards that side. Even though there's a little block here, it's not as significant of a block compared to this side because of the shape of this bone. So just understand that you will very quickly hit a roadblock going towards the thumb side. As soon as you do that, you're just coming up and you're moving around it. It's not abnormal. It means you're human.